This video PowerPoint was created with the assistance of generative AI for the purposes of reviewing safe blood product administration. We will be reviewing blood products, preparing for administering these blood products, basic administration procedures, and the principles related to transfusion complications. Blood products include various components, each serving distinct clinical purposes. Whole blood contains red cells, white cells, platelets, and plasma, and it's rarely used due to the availability of components. Packed red blood cells are essential for treating anemia and blood loss by increasing the oxygen carrying capacity. Platelets are critical for patients with severe thrombocytopenia or platelet dysfunction to prevent bleeding. Plasma contains clotting factors used in coagulopathy management. Cryoprecipitate is rich in fibrinogen and in factor VIII, and it's used for those with a fibrinogen less than 100 who are prone to bleeding or who have von Willebrand's hemophilia, which is lack of factor VIII. Understanding these distinctions is vital for targeted therapy. Transfusions are indicated based on clinical and laboratory parameters. For example, packed red blood cells are given for symptomatic anemia or acute blood loss, with hemoglobin thresholds commonly guiding its use. Current standards are between 7 and 8 for hemoglobin. Platelet transfusions are indicated for severe thrombocytopenia or those who are at high bleeding risk due to low platelet counts. Plasma is used to correct coagulopathies when urgent hemostasis is needed. Cryoprecipitate, again, is indicated for fibrinogen levels below 100 milligrams per deciliter or for those who have a deficiency in factor VIII. Judicious transfusion minimizes risks such as alloimmunization and transfusion reactions. Proper storage conditions are very critical for blood product viability. Packed red blood cells are stored between 1 and 6 degrees centigrade for up to 42 days. Platelets require room temperature storage with constant agitation for up to 5 days. Frozen plasma is stored at negative 18 degrees centigrade or colder for up to a year. Cryoprecipitate is also stored frozen and is thawed just before use. Compatibility testing, including ABR and RH matching, cross-matching, and antibody screening prevents hemolytic transfusion reactions. Advances in storage solutions and screening have improved safety and shelf life. Pre-transfusion assessment includes reviewing the patient's transfusion history, current clinical condition, laboratory tests, including the blood type and antibody screenings. Verification includes double-checking blood unit labels against patient identifiers and transfusion orders. This helps to ensure that the correct unit selection is there and appropriate identification and the appropriate indication as well. Clinical protocols and checklists reduce errors and enhance patient safety. Studies show that systematic verification protocols significantly reduce ABO incompatibility incidences. Accurate patient identification requires at least 2 independent identifiers by 2 individuals and is verified prior to transfusion. Obtaining informed consent involves educating patients about the benefits, risks, and alternatives to transfusions, and this complies with legal and ethical standards. Informed consent is the responsibility of our providers. However, it's the nurse's responsibility to make sure that that consent is available prior to transfusing the patient, unless it's a dire emergency, life or death emergency, for example. Clear documentation of consent and patient understanding is essential. Failure in identification increases the risk of transfusion errors and adverse reactions, including death. Selecting appropriate IV access, typically an 18 to 20 gauge or a central line, helps to accommodate blood viscosity and is critical for a smooth transfusion. Blood administration sets with the standard blood filters prevent microemboli and are used for whole blood, packed red blood cells, fresh frozen plasma, and cryoprecipitate. That means our standard Y set, where one side infuses saline and the other the blood product, is used for all these components. Platelets require a special filter and can be obtained from the blood bank at the time the platelets are retrieved. Tubing should be changed per protocol. Proper equipment minimizes hemolysis risk and ensures efficient transfusion over recommended durations. Remember, as soon as that blood comes out of the refrigerator, the countdown starts. Continuous monitoring of IV site also helps to reduce complications. The administration process involves verifying patient in the unit, ensuring proper IV access, initiating transfusion at a very slow rate for the first 15 minutes to monitor for reactions, then adjusting that rate as tolerated. And remember, before you go get that blood out of the blood bank, make sure that your blood administration set is primed with saline so that you're ready to go with that blood transfusion. Vital signs are recorded before, during, and after transfusion. Documentation of the start and stop times, the volume infused, and any adverse signs are essential. Adherence to protocols reduces the risk of errors and adverse outcomes. Make sure that you prime the blood tubing with normal saline, like I said, prior to retrieving the blood product from the blood bank. Platelets are administered through a single line tubing with a special filter provided by the blood bank. Close monitoring during transfusion is critical to detect reactions such as febrile, non-hemolytic, allergic, hemolytic, or anaphylactic reactions. Signs include fever, chills, rash, hypotension, or respiratory distress. Continuous patient observation, vital sign checks at baseline and intervals, and prompt response protocols such as calling the rapid response team and the patient's provider when the signs are noted, improve patient safety and outcomes. Early detection reduces severity and improves outcomes. Our transfusion reaction protocol is listed at SOP 113-8 and is not covered in this PowerPoint. Comprehensive documentation includes patient identifiers, blood product details, the type, unit number, and expiration, administration times, volume, vital signs, and any adverse events. Effective communication among the healthcare team members ensures continuity, facilitates adverse event reporting, and supports clinical decision-making. Electronic medical records and transfusion tracking systems streamline accurate record keeping and regulatory compliance. Recognizing transfusion reactions rapidly involves awareness of presenting symptoms, such as a fever, chills, urticaria, dyspnea, hypotension, hemoglobinuria. Distinguishing benign from life-threatening reactions requires clinical assessment, and often laboratory testing include direct antiglobulin testing and cultures. Timely identification is critical to prevent escalation and guiding treatment. Immediate response protocols entail stopping the transfusion, maintaining the IV access with a separate IV line of normal saline, frequent monitoring of vital signs, providing supportive care, and notifying the blood bank and clinical teams immediately. Severe reactions may require emergency interventions, including epinephrine, corticosteroids, or transfusion of compatible blood products. Preparedness and staff training decrease morbidity associated with transfusion complications. Post-reaction protocols include documenting the event in the patient record, notifying transfusion services and regulatory bodies, and conducting investigation to identify cause, including serologic studies and bacterial cultures. Follow-up ensures patient stabilization and informs future transfusion strategies. Reporting improves hypovigilance and safety system enhancements. In summary, understanding the types of blood products, proper preparation, careful administration, vigilant monitoring, and prompt management of complications are vital for safe transfusions. Adhering to protocols and effective communication enhances patient safety and treatment outcomes. This comprehensive approach ensures that blood transfusions remain a critical, life-saving tool in clinical practice.